Good morning. Actually, good noon, good afternoon. I'm Dr. Barb Brady. I am the Executive Director of Inspiring Dreams Network. And for today's Community Spotlight, we're blessed to have Kelly Caseman, who is Executive Director of Think Kids. And she is going to talk with you about her Thinks Kids nonprofit, as well as connecting kids to coverage in West Virginia. So without further ado, Kelly, I'll let you take over.
Well, thanks, Barb, and it's thanks for the invitation, and it's nice to be talking with you. I've known you for so long, and we haven't talked for a long time. So, congratulations on all the great work you're doing, and many thanks to those who have joined us, and hello to those of you I also know who I haven't seen in a long time. I'm going to talk a little bit about Think Kids and then the project itself, ways you can get involved, and then I would love to open the floor for any questions that you may have. And so we'll start with what is Think Kids? So Think Kids is a 501c3 nonprofit organization. We're located in South Charleston. We advocate for the health and well-being of West Virginia's kids. And so this is our website. And you'll see on the website, you can learn about current projects. You can get connected to and learn more about connecting kids to coverage. We have a very active blog. So we subcontract with a number of advocates and investigative reporters in our state to write and, explore some prevailing themes and issues that are of concern to us and West Virginia's kids. So, for example, Amelia Nisley, who is currently with the Registered Herald, most recently wrote on some data that she received from WVU Medicine on the number of kids who are presenting in West Virginia's emergency departments and mental health crises. And so you can take a look at our blog to learn more about our board of directors, and then how you can get connected. So you can subscribe to our website on our website. I'm sorry, our newsletter on our website. So I'm going to just jump in to the project itself. In July 2020, we received a grant from the Centers of Medicare and Medicaid Services for the Connecting Kids to Coverage West Virginia project. Before I talk about that, I want to talk a little bit about Medicaid and CHIP, or the Children's Health Insurance Program. Just some basic information to help you understand and contextualize a little bit about the project. So Medicaid is a program that provides health coverage to millions of Americans, including low-income adults, children, pregnant women, elderly adults, and people with disabilities. It's administered by states according to federal requirements. Our federal requirements, but the states have some leeway as to who they cover, what they cover, and ways that they go about the processes. The program is funded jointly by the state and the federal government, and over 588,000 West Virginians are enrolled in Medicaid and CHIP as of July 2021. So this is the state Children's Health Insurance Program's website. It's also a partnership between the federal government and states to provide health insurance for children of low and moderately low income families who are not eligible for Medicaid. It was created as part of the Balanced Budget Act of 1997, and outreach and enrollment surrounding CHIP programs effectively cut the children's uninsurance rate by half. And so if you were around back then, like I was, you'll remember that our Senator Rockefeller played a critical role in introducing this legislation and advocating to push it through. And so CHIP plays a really important part of insuring West Virginia's kids. So for some context, Medicaid is the bigger program, and it insures a variety of different demographics. I hope you're okay, Barb. I just keep letting people in as they join us because it's popping up my screen. And so We have around 220,000 kids who are enrolled in West Virginia Medicaid, and then we have around 25,000 who are enrolled in West Virginia CHIP. Those numbers have grown as the public health emergency was declared, which I'm going to talk about in just a little bit. Oh, somebody needs to turn on their mute. So the Insure Kids Now campaign is a national one to improve child participation in these two programs, Medicaid and CHIP. And the Connecting Kids to Coverage campaign is a national enrollment initiative that is part of the Insure Kids Now campaign. And its goals are to raise awareness about health coverage available under these programs, create opportunities for families to get their eligible children and teens signed up for coverage, and motivate parents to enroll their children and teens and renew their coverage. And then this project provides outreach guides and toolkits that can be used to help states, community organizations, groups like you and me, provide and organize and conduct successful outreach activities. Now, it's from this campaign that we received a grant. It was in July 2022, and it is a 3-year, $1.48 million grant to reach uninsured kids and renew them in Medicaid and CHIP. So here's why that is so important. There was a time, probably, I'm going to say 10 years ago, when we had one of the highest insured rates of kids in the country. So we were at around 2.4% of kids who did not have health insurance in the country. And that put us around, I think we ranked 4th at that time nationally for the number of kids insured, which was, as you know, we don't always get counted in the good columns. We're always highest in the bad columns. So this was something that we were doing really well. And it was really a source of pride. I certainly was proud of all of the work that the state was doing to ensure that kids had health insurance. Now, a couple of things have happened since then. One is on the federal level, some funding that used to go into outreach and enrollment from the federal government subsided. We saw the legislature cut back on the budgets of DHHR, and that moved some money around, and we saw fewer people doing outreach initiatives. And then we see our DHHR offices really burdened with a lot more kind of pressing issues. And so what we see was a lot less outreach going on in communities, and that resulted in an escalation of the number of kids insured. We still have a pretty high insurance rate in West Virginia, but they estimate we have somewhere between 12,500 to 13,000 kids now who are uninsured in West Virginia. So our campaign is focused on that, as well as addressing the public health unwinding. So a little bit about that. In March 2020, Congress and former President Trump enacted a bipartisan provisions to stabilize health care coverage for low-income children and families by increasing the federal government's contribution to state Medicaid programs. Now, this was during the COVID-19 pandemic, right? So this started in March 2020, and it required states to maintain continuous coverage of all Medicaid beneficiaries for the duration of this public health emergency. In West Virginia, we kept continuous coverage for both Medicaid and CHIP beneficiaries. And so this means that no individuals on these programs had to renew their coverage, which usually happens annually, since March 2020. As the U.S. ends the public health emergency, millions of people are expected to lose their Medicaid coverage for two reasons. One, their income has risen and they may no longer be eligible for Medicaid and CHIP. And two, red tape barriers to inadequate communication or support from the states prevents families from renewing their coverage even though they remain eligible. And so, as many of you know, in West Virginia, particularly low-income families, they have to move around a lot. Children move around a lot, particularly due to poverty and the drug epidemic. They may move from the family's home to grandparents to extended families. And so most states and these programs rely on contacting individuals via USPS, right? They send them something in the mail. If they do not have updated mailing information, they're not going to get this information. And so the fear is that we're going to see an escalation of uninsured kids and families due to the end of the public health emergency. And so our cooperative agreement with CMS for the next 3 years is to enroll kids who are currently not enrolled in health insurance. So it's that kind of elusive small percentage, and then renew coverage for kids, pregnant women, and sometimes families in these important programs. So that's what we're going to be doing with this project over the next 3 years. And we're going to do this in 3 ways. One of the first is our public relations campaign, and this is managed by the Manahan Group, and they created this great website. And so this is something that you'll see heavily shared on social media and in outreach work that we do. And folks are able to get information on the 2 programs that we're discussing, as well as events in their area, and then they can sign up to stay connected to the campaign from this website. We also have a Facebook page that the Manahan Group is overseeing that shares relevant information. And by relevant, like, for example, there's me talking about our event today. And then I'm going to share a few videos with you in a minute. And then it also shares events and other healthy kids information that you can like and share if you'd like and learn more about the project. Then I'm going to share a couple of videos with you, and we're working on videos in 2 ways. So one, we want to create this statewide support for this work and try and create a connected approach to ensuring that this important messaging gets out to every family, particularly in rural areas of the state. And then secondly, we really want to highlight what's happening on the community level, which I'll talk about our outreach coordinators in a minute. But we want to make sure that we're helping them try and engage these families in conversations, because not everybody has the, education or experience in working with health insurance. As you know, it can be incredibly confusing. Signing up for any kind of social system within the state can be really confusing. You don't know what information you need to share. You don't know if you're eligible. And so we're giving funding for folks to try and work with people one-on-one. But in order to know that they're there, we really need to do PR to ensure that everybody in the community understands where they are, the work they're doing, and how they can get connected. So I'm going to talk about that in a minute. But before that, I'm going to share a couple of videos. I'm going to start with Senator Shelley Moore Capito. After these messages.
Every child deserves to be happy and healthy, and having health insurance plays a big role in that. Medicaid and the West Virginia Children's Health Insurance Program, or CHIP, cover everything a child needs to be and stay healthy. In West Virginia, 4 in 9 kids rely on these programs for their health insurance, ranking us 12th nationally for the percentage of kids insured. But we still have over 12,000 kids uninsured. If your child or children are covered by Medicaid or CHIP, be sure to contact these state programs to confirm that they have your most up-to-date mailing address so that you will receive the necessary paperwork to re-enroll your child when necessary. If your child does not currently have health insurance, see if you qualify and enroll now. Go to Connecting Kids to Coverage CKCWV.org to access outreach event information, contact request forms, and more information on these important programs. We've always been national leaders when it comes to insuring kids, and let's continue that. Quality health insurance for children in our state is affordable, available, and an easy enrollment away.
So many thanks to the Senator and to the Manahan Group. That QR code will take you to the website that I just showed you. And here is a message from State Superintendent David Roach.
Hi, I'm West Virginia State Superintendent of Schools, David Roach. Like you, I believe the health and well-being of our children is the highest importance. Healthy, well-supported children are likely to come to school ready to learn and achieve at the highest levels. Our community partner, Think Kids, is a West Virginia-based nonprofit that recently launched the Connecting Kids to Coverage West Virginia campaign. This statewide initiative provides assistance and information to parents seeking health coverage for their children. The U.S. Department of Health and Human Services declared a federal public health emergency in the wake of the COVID-19 threat. This official declaration is scheduled to end this year. Therefore, hundreds of thousands of West Virginia children will need to re-enroll in Medicaid and CHIP for their health insurance. It is critically important for families to contact these agencies to inform them of any updated contact information so that they can receive the necessary paperwork to re-enroll their children. This is an opportunity to remove obstacles for our kids. Medicaid and CHIP provide no cost or low cost health coverage for eligible children in West Virginia so that they can get routine checkups, immunizations, and dental care. West Virginian children remain our most precious resource. Together, we can ensure our children attain the health care they need. Thank you for listening.
So great. So we're really proud of the PR campaign that we've created, and we are working with, I said it was a three-prong approach. So that's prong one. Prong two is working with county school systems. And so this year to date, and when I say year, I mean from July 2022 to July 2023, we have two county school systems that are partnering with us. One is Kanawha County School System, and the other is Roane County Schools. And as the project progresses, like in year two, we plan on partnering with a few more school systems, and then the same in year three. Now, we may partner with Kanawha County Schools for the duration of the grant simply because it's such a large school system, largest in our state. But we're also very mindful that we need to go into our smaller rural counties because that's where we find that increasing number of kids who are uninsured. So it's striking that balance, and we give funding to the schools. So it will kind of defer the cost of staff time, and then they can use that money for outreach activities. Now, the third prong is that we're partnering with after-school programs. And so currently we're partnering with Step by Step, which is in Kanawha County, but it also provides services in Logan and Lincoln counties. And we're partnering with the Partnership for African American Churches, and they are in, I want to say 5 counties off the top of my head. So they provide after school programming, but they do a wealth of work. And some of them is focused on healthcare around COVID-19 testing and vaccinations. So they are in a number of counties and a number of churches providing outreach and education. So they're a really important partner. And then finally, our last partner is, oh gosh, their name is escaping me. It'll hit me in a second. The Boys and Girls Club of the Eastern Panhandle. I'm actually in Alexandria, Virginia, and I'll be on a site visit with them tomorrow. And so they're doing wonderful work, doing needs assessments in their 3 sites in the Eastern Panhandle. And they're asking if parents and kids have health insurance, and if they don't, if they'd like some help enrolling. And so they're also partnering with a couple of nonprofits to help get the word out. And they're also partnering with Berkeley County Schools. And I'm hoping that we can get partnerships going in other 2 counties there, so we can do more education about the benefits of having health insurance, and seeing if we can get some information home to direct those folks to our enrollment coordinators. And so these enrollment coordinators are identified by the subcontractors in the school and after school programs. And we do training with them, and then it's kind of an ongoing process. So these are people who don't come from the healthcare system. So they don't necessarily, kind of understand the navigation process. Sometimes they feel uncomfortable talking about people with health insurance. So we try and provide professional development as we go. So this is our Think Kids events page, and you'll find a number of events that folks have coming up over the next few months. You can subscribe to the calendar if you'd like to get updates. And we're really kind of excited that people are getting out there and talking to people. And so that is the whole of the campaign. I see I have about 5 minutes left, and I want to make sure that people have time to ask questions. So if you are wondering what you can do to help, here's what you can do. You can sign up for our newsletter if you don't already do so. So you could go to this page right now and just plug in your first, last name, and email address. You can go to the campaign website as well, and you can fill in your information at the bottom. You can find events in your area and encourage individuals to attend. You can share information about the unwinding and this campaign with families who may be enrolled or need to be enrolled in health insurance. You can, if you work with a county school system or an after-school system or after-school program, and you think that this may be a good fit for you, please reach out to me. I would love to talk with you about it further. We can meet with your administrators and discuss the logistics, kind of the time that would be needed, what we would need from you, what kind of funding we would provide you with to do this work. And then we want to make sure that regardless of whether or not you're working in this campaign, that you're providing that important information as the public health emergency ends, that it is critical that kids maintain health insurance and are accessing preventive services like vaccinations, like, screenings, well child care, so we can ensure that they're developing appropriately, that things are nipped in the bud when they're first identified, and that they have, that access to healthcare that makes, that can really change the trajectory of their lives, that they stay. We want to keep them safe, keep them healthy, and give them hope. And so this is a really key component to keeping them healthy. And with that, I'd like to open the floor to any questions you may have.
Thank you, Kelly. What kind of questions or comments do we have? Kelly, I guess I have a question. One of the things that I do in addition to running a nonprofit is I do private practice therapy. And this has been a reoccurring issue. Is there going to be a similar program, do you know, for adults who don't have coverage? A couple of my clients really need to, see a psychiatrist to get medication for anxiety, depression. and they won't go because they don't have coverage. They're just above the cutoff, so they don't have a lot of, disposable income. Does this program work with them at all, or is there a similar program for adults?
That's a wonderful question. So a couple of points. First off, if an adult had questions, they are welcome to talk with our coordinators. But there is a navigation program in the state called First Choice. And what they're going to play such a critical role as the unwinding continues, because a number of people are no longer going to qualify for Medicaid, and they're going to be pushed into the marketplace. And so the marketplace in West Virginia, there was a time when it was very expensive, right? So we don't have a lot of competition. I believe that we still only have 2 providers, but it has become much more affordable over the last couple of years. And so what the folks at First Choice can do for them is can walk them through their eligibility. And then they can talk to them about what kind of rebates or the cost per month in the marketplace. That's really kind of their area of expertise. And so I would highly recommend that they speak to the folks at First Choice. And then finally, if people are kind of wondering where everybody is going to be working, like what across the field, because there are a lot of different projects and programs going on to try and get the word out about the unwinding and the fact that people need to update their information and renew their information to qualify. So on March 8th, we are having we're calling it the Big Tent meeting with the West Virginia Center on Budget and Policy. Folks from the Department of Health and Human Resources will give kind of an update presentation about how all of this will unroll over the next year. And if people want to see like what the managed care organizations plan to do, what Kanawha County Schools is going to do a presentation, they can, if they just kind of want to get a feel about where all of this information is going to come from and where to turn if they want to provide further information to folks, that would be a really important presentation or event for them to attend. And so if they want to email me, I will send them the logistics.
Thank you so much. Other questions?
A question. This is Roxanne Clay with the WV Able Savings Program. Kelly, I'm not sure if you're familiar. It's savings that's designed specifically for individuals with a disability. And I'm just curious of the data that you provided for the 13,000 kids that are, don't have insurance. Do you have information about the number that's representative of children with a disability that's included in that 13,000?
I don't. I will say this, one of the projects that we work on with Think Kids is the importance of getting data for marginalized populations, such as the disability community. And so it's really hard. We're working on a project with the Developmental Disabilities Council to try and get data as to how many kids now and how much have increased with disabilities are in our school system. Mm-hmm. And so I think that there's always this need to get more data on children and adults with disabilities in West Virginia. And that's something that we consider a priority at the organization.
Okay, thank you. It's a great presentation too, very informative. I wasn't sure what exactly Think Kids. I hear the name and I hear your name, Kelly, as well. So it's just great to be able to put it all together now. So thanks, Barb, for offering this too.
Sure thing. Other questions? Well, Kelly, I am going to stop recording, but we can stick around here for a minute. Some people don't want to be recorded, probably, or may not want to be recorded. So we'll stop recording. Thank you so much for a very informative presentation. I learned a lot.
Well, great. Thanks for having me. And it's always nice to see your face.